Have you ever had that sudden sharp pain in your stomach that just makes you stop and think, uh-oh, is this serious? It's a really common fear, and for doctors, it can be a genuine medical mystery. So today, we're going to get inside the mind of a surgeon and see exactly how they piece together all the clues to solve the puzzle of a painful abdomen. So let's start with the big question. Why is a simple stomachache sometimes so hard to figure out? Well, think about it. Your abdomen is just packed with different organs, all close together. And when something goes wrong, the symptoms can be pretty vague and even overlap. Pinpointing the exact cause is like a masterclass in detective work, and we're about to see exactly how they do it.
Okay, so where does this whole investigation begin? It always starts in the same place, with the patient. That's right, before any fancy scans or tests, the most important tool a surgeon has is just listening to your story. The specific details of your pain, those are the first and honestly the most critical clues in the entire diagnostic puzzle.
And you know, this isn't just a casual chat. Surgeons are actually using a kind of mental checklist to cover all the bases. They're going to ask about the type of pain. Is it what they call colicky, which means it comes and goes in waves like a bad cramp? Or is it just a constant, nagging ache? They'll ask about fevers, vomiting, and any other symptoms you've got. Every single answer is like a dot, and the surgeon is trying to connect them all to see the bigger picture.
All right, so once the surgeon has a good idea of what the pain feels like, the next huge clue is where it is. And this is so key. Surgeons don't think of the abdomen as just one big area. In their minds, it's a map, with all the different organs living in very specific neighborhoods.
And this whole idea of dividing the abdomen into quadrants, it's actually a brilliantly simple but super powerful tool. It's a universal system, which means any doctor anywhere in the world can speak the same language. By having you point to where it hurts, they can immediately narrow down the list of possible culprits based on which organs live in that particular neighborhood.
And right here, you can see the power of that map in action. If you point to your right upper quadrant, a surgeon's mind just immediately goes to the gallbladder. Pain in the right lower quadrant, suspect number one is almost always the appendix. And pain over on the lower left side, that often points to the large intestine and a condition called diverticulitis. It's an incredibly effective way to kick off the investigation.
Okay, so we've got the clues from your story and from the location on the map. Now it's time to meet the usual suspects, the three most common conditions that bring people to the emergency room with really bad abdominal pain.
First up, we have appendicitis. The surgeon from our source material, Dr. Lucy Scott, actually calls this the bread and butter for general surgeons. It's that painful inflammation of the appendix. You know, that little finger-shaped tube that hangs off your large intestine. The classic story they're listening for is a pain that starts kind of vaguely around the belly button, and then over a few hours gets sharper and moves down into that right lower quadrant we just talked about.
Suspect number 2 is cholecystitis. Yeah, I know, it's a mouthful, but it just means your gallbladder is inflamed. This is the little organ that stores bile, and it usually gets angry when a gallstone causes a blockage. And guess where it hurts? Yep, exactly where our map predicted, the right upper part of the abdomen. See how all these clues start to lack into place?
And our third usual suspect is diverticulitis. This happens when these small, bulging pouches that can form in the lining of your colon get inflamed or infected. Now, while it's most common on the lower left side, this is a perfect example of how the body doesn't always read the textbook. Sometimes, the pain can pop up in other spots, which is exactly why surgeons have to keep an open mind and consider all the possibilities.
So at this point, the surgeon has a pretty strong theory, a prime suspect. But to be absolutely certain, they need to gather some hard evidence. And that's when they turn to medical imaging, to get a direct look inside your body and confirm what they think is going on.
A lot of times, the first tool they'll reach for is an ultrasound. It uses sound waves to create a live picture of your organs, and is fantastic for looking at the gallbladder. A technician can actually see the telltale signs like gallstones or a thickened gallbladder wall and confirm the diagnosis without using any radiation at all.
But for other conditions, especially if they're thinking appendicitis, the CT scan is really the gold standard. You can think of it like a series of super detailed X-ray slices all put together by a computer. It creates this amazing cross-sectional view that can clearly show an inflamed, thick-walled appendix, the definitive sign. This is what turns a strong suspicion into a certainty.
And then for those really specific kind of tricky situations, there are even more advanced tools. An MRI can be used, and there's a special type called an MRCP. It's designed specifically to look at all the tiny tubes of your bile ducts. It's used to answer a very specific question. Has a gallstone escaped the gallbladder and gotten stuck in the main plumbing, causing a really serious blockage?
So, the mystery is solved. The surgeon knows the cause.
The final step is to actually fix the problem. And while each condition is a little different, the core management plan is surprisingly consistent and totally logical.
This 3-step plan is really the foundation of care. Step 1 is immediate, analgesia. That just means getting you strong pain relief to make you comfortable. Step 2 is all about support. IV fluids to keep you hydrated and antibiotics to fight off any infection. And then Step 3 is the definitive fix. Planning for surgery, like taking out the appendix or the gallbladder, to solve the underlying problem for good.
And we're going to end on this really powerful quote from Dr. Scott, because after all the science and technology and tests, she brings it right back to the most important thing of all, communication. This whole diagnostic journey, from the very first symptom to the final treatment plan, is a partnership. And it's just a crucial reminder that when it comes to your health, no question is ever a silly question.